Hi, my name is Pete Edwards, and I'm an orthopedic surgeon. I do predominantly sports medicine, not predominantly, I do all sports medicine, and I've been using the program for about a year, and I think that there's some tricks and some things that I found out from talking to about 1,000 patients about Prescribed Fit that helped me figure out how to make the conversation easier, more patient-focused, and not as awkward as you think it might be when you're first starting. So I always talk about treatment options first, and the last thing I include is weight loss, because it lets you have that interactive discussion with your patients so that they feel like they're participating in the process. And what I found is by the time you run through all the different treatment options, injection, surgery, not surgery, physical therapy, by the time you get to the last one, half the time the patient will say, and of course I need to lose weight, and you kind of lead them to that discussion and they bring it up, which is far less threatening than just jumping right in. So I think you kind of build up to that discussion a little bit, and you also let them know that all these things work together. And I think that gently going through that process is really helpful. I always outline for them that the program is different than what they've probably done before, because so many people have dieted this, dieted that, keto this, whatever, and they know that their weight goes like this, which is actually less healthy than being continually obese or continually thin. The cycling is really bad for them, and a lot of times the people will be nodding their heads at that stage going, yes, I've done this a million times. I lose it and then I gain it back. So I introduced the idea of incremental behavior change, and that is you lose a pound a week. It's not very threatening to lose a pound a week, so they don't feel like they're changing their diet, changing their lifestyle. It's a gradual process. And a lot of people just want their hands to be held through the process because they've dieted on their own. But when they learn that part of the program is a health coach that calls you every week, that becomes your friend, that knows your triggers, that knows your family, that knows your dog just had their ACL done and they can't walk the dog anymore, so they gain weight. I mean, the health coaches from Prescribed Fit know all those things. So it really helps people develop a relationship with their health coach. So they don't want their health coach to be disappointed with them. So that's even more motivation for them to lose. So that's one thing. We talk about how good the app is and how interactive the app is, and how the purpose of the app is to keep their focus on the prize, which is losing weight. So if they get a notification every morning that says, here's your goal for today, or try to get 100 more steps, or drink a big glass of water before your meal, all those little reminders help them be better at the program. And then finally, the digital scale is really cool because it talks to their cell phone, and so there's an interactive part of that, and they see that on their phone and they see it track their weight loss. And I can't tell you how many patients I've had come in and say, look at my graph, because you can see how I'm marching down the steps and losing weight. And so that's really rewarding for them. So I hope these little hints have been helpful, and really once you start talking to people about it, you're going to find that rather than being nervous about it, that some of my most grateful patients are people that say, I can't believe you took the time to talk to me about this, because even my primary care wouldn't do that, and I know it's an issue, and I really appreciate the fact that you took time to do that.